Are you confused about doing orthostatic vital signs or blood pressure, or don't even know what it is? Stay tuned. I'm here to give you all the steps on how to do orthostatic vital signs along with the true definition. Welcome everyone to the Mama Nurse channel. I'm Vanessa, and here we discuss all things nursing, motherhood, and lifestyle. Leave a like on this video and any comments down below, and don't forget to subscribe so you don't miss out on any uploads. So by definition, orthostatic vital signs are a series of vital signs taken for your patients who are at high risk for hypovolemia from vomiting, diarrhea, dehydration, patients who have had a syncopal episode from dizziness or fainting, or patients who are at high risk for falls. Keep in mind that a significant change in these vital signs does put your patient at a higher risk for falls as well. So make sure you're standing by close, or that you have another nurse, or you have somebody else nearby to help out just in case. Step number 1, have your patient lie down in a supine position for 5 minutes. Try to keep them calm, just in a natural position, no distractions, legs uncrossed. Next, you want to make sure that you measure your blood pressure and your heart rate. Next, have your patient sit on the edge of the bed for 2 minutes. At my hospital, it's 2 minutes. Some hospitals may be a little bit different, so just check your policy on that. But for this video, we're going to use my hospital's rules. So have your patient sit on the edge of the bed for 2 minutes. Again, measure your blood pressure and your heart rate. Next, have your patient stand for 2 minutes. Once again, hospitals may vary, but for this video, have your patient stand for 2 minutes. Measure your heart rate and your blood pressure. Some policies or hospitals require that you measure the standing blood pressure and heart rate after 1 minute and again after 3 minutes, so just keep this in mind. At this standing point is typically, if your patient is going to have a positive reading, you would notice it here, and this is typically where the increased risk for falls occurs. Typically sitting on the edge of the bed, patients are still okay, but once they get into that standing position, they get more lightheaded, dizzy. So just make sure that your patient is safe and you're standing by, maybe even doing a close contact hold. That way you can protect your patient and make sure that they stay safe. Results are read as either negative or positive. Negative obviously means that the patient had no significant change in their blood pressure or heart rate. Positive means that there was a drastic change. So a positive orthostatic blood pressure would be, for example, if your patient's systolic blood pressure dropped 20 millimeters of mercury below the baseline blood pressure, or if the diastolic blood pressure dropped 10 millimeters of mercury below the baseline. I'm going to try to insert some numbers here to show some examples of negative versus positive blood pressure readings when it comes to orthostatic vital signs. So they'll be either following this clip or on the page with me. So this will describe or show you better examples of what a negative versus a positive orthostatic blood pressure reading would show. Warning: if your patient becomes symptomatic during the exam, please stop immediately, lay your patient down in a supine position, that way they can recover, and report to your doctor that you were unable to complete the exam for whatever reason. A positive result or the patient becoming symptomatic would require a doctor notification. This concludes the orthostatic vital signs video. Make sure to like, comment, and subscribe, and until next time, all love.